I see, especially in social media, something that's disturbing sometimes, in my opinion, which is over removal of the bone, over reduction of bone.
Oh my gosh.
So, and some of these clinics are very successful. And it's because I know it can be done in a different way, which is more conservative. It kind of breaks my heart sometimes to see it. So Dr. Salama and I actually already published last year or a year and a half ago about the scallop design. Excuse me, sorry.
That's all right.
So the scallop design is, instead of us cutting the bone flat and removing excess bone that we can save, we actually scallop the bone to create the same architect as the tooth margin, which actually reduces bone reduction and also looks more natural. Yeah, this actually is a proof of that concept. So if you want to see this, this is pretty impressive actually. So instead of us doing...
So how many okay, so are you at 8 millimeters, 5 millimeters, 10 millimeters? What is your average? And I know it sounds like I know each one's custom, but how
so
much?
Depending on the implant positions and how many Pontics we have and how many cantilever teeth we have, the numbers do change. They can range anywhere between 10 to 14 millimeters.
Okay.
Minimum, I would say 8 to 9. Also, the bite change. The bite scheme actually change. If we have thinner zirconias, we reduce bite forces. So there are so many factors that most people don't even really realize. And that was my main interest back in school, is actually treating All-On-X patients. I call it All-On-X because we don't go for All-On-4. Minimum All-On-6, if we can fit 8, that's even better. We always over-engineer the process. In case you have 1 failed, 2 failed, you can still keep going. So this is very interesting right here. So this is a scalloped bone right here. And this scalping was actually done by this surgical guide right here, as you can see there. And the scalloping of the bone matches our prefabricated design that we have before surgery. So this fits right on after we place the implants, which the implants are also guided using this guide right here, which all of these guides we created in the office and printed them here. So we make our own guides and everything. So this guide fits on, and the drilling happens for the implant depth and location. Because I know my implant location, I can already prefabricate my temp with the right hole position. And when the implants are placed in the patient mouth and the bone have been already scalloped before that, we place the prosthesis and then I pick it up. Now I have a perfectly scalloped bone. I have the right spaces between the prosthesis and the bone, allowing for the tissue to actually grow into the papilla, which is something extremely hard to do.
That's really difficult.
Yep.